This is a corrective exercise routine you would do for 15 minutes twice a day for 6 to 8 weeks to deal with SI joint pain. And with that, you may have sciatica, which is not coming from the low back, but from the SI joint. There are tests your PT can do to determine if that's the issue that you're facing. Usually 3 out of 5 means it's the SI joint, and then this is the pain pattern it presents with. We're going to start with inhibiting the overactive muscles, starting with a right adductor stretch, coming down into all fours. Gonna tuck your hips, bring your body forward, bring that right leg out to the side, and evert your foot so you feel that stretch on the right adductor. And you're going to hold this position for 6 breaths, inhaling through the nose for 3 seconds, exhaling for 6 seconds, and leaving a little bit of a pause at the end of the exhale. In this quadruped position, you're keeping your hips tucked, shoulders externally rotated, fingertips pressing down into the mat. So you're keeping those obliques on, and you want to feel those obliques engage as you exhale. Keep holding here for 2 more breaths. Next, we're going to do the right obturator internus stretch, and we're going to do this in a 90-90 position using a ball to get a myofascial release of the right gracilis while also stretching the right obturator internus. As you hold this position, you'll inhale gently through the nose, exhale, sigh, and reach. Holding this position for 6 breaths. Next, we're going to get a stretch of the superficial back line on the right side, standing with your weight over your left heel with your right foot forward. Bend down into a little bit of a mini squat. Reach the right hand forward, grab the front of your right foot, let your head relax down, sink back into your left hip. You'll feel a stretch all the way down the right side of your body from the back of your head to the back of the calf. Hold that for 6 breaths. Next, we're going to take this into a kneeling left hip flexor stretch with a focus on the TFL. So in that kneeling position, you're going to tuck your hips. Make sure your rib cage is stacked over your pelvis. Slightly lean forward so that you feel that stretch. Keeping your hips tucked so you won't take much motion to feel the stretch in the left hip. Then you're going to reach your left arm up and over towards the right so that stretch moves across the TFL, which is the pocket area of the left hip. You're going to hold this position for 6 breaths, 3-second inhales through the nose, 6-second sigh exhales. Next step in this routine is to mobilize, and we're going to do a technique for a self-mobilization of the right SI joint, laying on your right side with your right leg straight, hips aligned. Bring your right hand on top of your left knee, which is stacked on a foam roller. Place your left hand behind your head, elbow out. Inhale. As you exhale, roll out. Inhale at the back. Exhale, roll back to center. So this spinal rotation should give you a gentle mobilization of the right hip, which is down on the ground. I didn't leave myself quite enough space here, but you want to give yourself enough space to be able to reach that right elbow back as far as you can, and ideally be able to touch the floor. And do that 5 times. Inhale, move on the exhale. Inhale in the extended position. Exhale back. Now we're moving into the activation phase where we're going to start turning on some muscles that haven't been working properly, starting with a quadruped alternate arm leg raise. So hips stacked over knees, hands under the shoulders, tuck the hips, bring the body forward, keep those shoulder blades externally rotated, tips of the fingers pushing down. Fix your gaze over your fingertips. Look over your left hand as you reach the right arm out, keeping the left shoulder externally rotated, keeping the hips tucked. Reach the left leg behind you, and hold that position for 5 breaths, not letting your back arch and keeping the abdominals engaged. After holding this position for 5 breaths, you'll come back down, go back into a quick child's pose. Inhale, exhale, come back, reset. Bring the body forward so the eyes are past the fingertips. Fix your gaze just past your right fingertips, keeping the right shoulder externally rotated, left arm out. Right leg reaches back without letting the back arch, keeping the hips tucked. Hold that for 5 breaths. Coming back down, inhale and exhale with a child's pose. We're going to do the same thing on each side one more time. You want to maintain good position. You want to be able to feel that X across the body, opposite shoulder to hip, stabilizing as you hold this position. You're going to feel that in opposite directions on each side. It's important to maintain good alignment, keep that rib cage in line with the pelvis. You want to feel strong in this position. Keep it active, engaged. Don't let your body sink. You don't want to be passive. It's good to feel some shaking. That means it's working. Next, we're going into a serape squat, which engages the spiral line. Now we're going to start by putting this over the right shoulder and bring this around the back and across the left hip and then around the right foot. When you bring that foot down, we want to make sure we position this so that the bottom part of the band goes just over the left ankle, and the top part of the band comes behind the knee, following the tensor fascia up to the greater trochanter on the left. And that bottom part of the band is going to go right over the sacrum. Now, when you keep the band like this, you're going to go into the squat exercise, which from here is basically going to be a PRI wall squat. Bend the knees, weight in the heels, tuck your hips, externally rotate the shoulders. As you go into that squat, reach, and then this is a PRI wall squat without the wall. Inhale softly through the nose and feel the low back expand on the left to stretch the band. That's getting a posterior mediastinal expansion. And as you exhale, slightly reach. You're going to do this for 5 breaths. Inhale through the nose. Reach a little more on the exhale each time. And after 5 breaths, you're going to come up. And then you're going to repeat that for 2 more sets for a total of 3 sets of 5 breaths. Each time you reset, make sure you externally rotate those shoulders. Knees track towards the toes, weight in the heels. Inhale, expand the low back, posterior mediastinum on the left, stretching the band. And as you exhale, reach. And sink just a little more into the squat on each exhale. If you don't have a band, you could just do a PRI wall squat. That's something you can look up, or I can put a link to how to do a PRI wall squat in the description of the video. 1 more set, externally rotate, weight in the heels, knees toward the toes, reach, sink, inhale, stretch the band, exhale, reach and sink. The next exercise we're going to go into is a ball bridge. And we're going to do this with a small kettlebell. Getting in position on the ball. When you come up, keep your rib cage and hips aligned, glutes and abs engaged, holding that weight steady. You're going to come up quick, hold it. 1, 2, down, 2, 3. Up quick, hold. 1, 2, down, 2, 3. We're going to do this at this tempo for 12 reps. Keep those heels driving into the floor, glutes engaged. Concentric, up quick, hold it, isometric 2 seconds, eccentrically lower, 1, 2, 3. After 12 reps, we're going to move on to the next exercise, left single leg touchdown. Weight on the left leg with the right leg slightly forward and hovering 1/2 inch off the ground, not letting it touch down or be a counterbalance. You're going to slowly, eccentric left hamstring, bring the hip back as you reach your right hand down to touch the left toe. Hold it for 2 seconds and up quick. 12 reps. Down, 2, 3, hold 2, up quick. Down, 2, 3, hold 2, up quick. Try to maintain that balance. Down, 2, 3, hold 2, up quick. Down, 2, 3, hold 2, up quick. And keep going for 12 reps. on this nice and slow exercise, eccentrically contracting the left hamstring on the way down, concentrically on the way up. Final exercise is an integration exercise, which teaches your body to use the muscles now that they're in balance. This is going to be a right arm row to split squat. So we're going to come into that split stance position, pushing the left heel down into the ground, tip of the right toe into the ground, and ball the foot back behind you. As you inhale, roll the right arm back. Exhale, bring it all the way out, and then down and up into the split squat. Inhale, one long exhale, all the air out, and then like you're squeezing the tube of the toothpaste from the bottom to get the last out, you continue to exhale as you bring it down into that split squat. 12 reps here. Inhale, 2, 3, long exhale, swing, squat. Inhale, pull, long exhale, swing, squat. Keep that left heel pushing into the ground, tip the right toe pushing into the ground, ball the right foot pushing behind you. You want to keep those legs engaged. Keep the rib cage stacked over the pelvis. Body stays active, isometric contractions. Keep your torso stable as you rotate. After the 12th rep here, you're going to want to walk around a little bit and notice how that feels on the hips. Should feel really good. And again, this is a routine you're going to want to do twice a day, 6 to 8 weeks until symptoms improve.